So good morning, good afternoon, or good evening, wherever you are in the world. It's a pleasure to see so many of you here today at Queen Mary's Global Policy Institute Global Seminar Series. For those not familiar with the work of this institute, its mission is to ensure Queen Mary's commitment to inclusion, diversity, and positive social change, and find their application of all of these things to policy making, taking our world-class research and translating it into positive social and practical impacts by addressing key global problems across a range of policy areas linked to our priority themes. Those priority themes are rights, inclusion and diversity, resilience and sustainability, health, recovery and reform. To find out more about the Institute, we'll be sharing links with the attendees. So all of you, please do take a look at the considerable output, which includes a world-leading event series, research projects tackling everything from social inequity to artificial intelligence and the role of ethics, and also providing evidence to government through parliamentary committees or policy briefs and opinion pieces from climate to the rule of law in the digital age. Turning to today's Knowledge Partner Seminar, which forms part of the 2022 OECD Global Anti-Corruption and Integrity Forum, an event that brings together stakeholders across the policy communities to discuss how creating different frameworks could resolve long-standing challenges. We partner up with OECD for this knowledge partner session, where we will discuss the relationship between trust and integrity and reflect on the important role of experts in fostering trust and integrity and drawing on lessons from the global pandemic. So the subject for today's meeting is the role of experts in promoting trust and public integrity, lessons learned from the global pandemic response to COVID-19. I'm delighted to be joined by a distinguished panel with a depth of expertise. Each of these will provide their own thoughts on the task at hand, and then you'll have a chance through the Q&A box that you can see at the bottom of your screen to enter questions. Please do post challenging thoughts, test our experts, and let's make them sweat. So I'm now going to pass on to our first speaker, but just before it, I forgot to introduce myself. I'm Professor Sir Mark Caulfield, and I'm Vice Principal for Health at Queen Mary. I'm now going to invite Stella Laddie, Reader in Public Management here at Queen Mary, who will provide a few words of introduction and opening remarks. Over to you, Stella.
Thank you, Mark, for the introduction, and thank you all for participating. Maybe if I can have the PowerPoint shared now, I can present some of them. Yes, thank you very much. So what I will be doing in this first few minutes, hopefully, and by the time our other speakers also join, is to present some of the findings and thoughts and policy proposals that came out of a project that we were running last year at the Global Policy Institute, funded by Research England, on the role of experts in promoting trust and the COVID-19 pandemic. So if I can have the next slide, please. So first, let me remind you why we brought in this panel, this topic today in this knowledge partners events for the OECD. There are some questions that we think we can try to address as panelists, but we also want to bring out in general to the discussion and to develop further. First of all, is whether we have learned something about trust in government institutions during the pandemic, and if what have we learned? And also, what have we learned about trust in experts during the pandemic? So do the two relate? Are they independent? How can they make this relationship between experts and public institutions work in order to have trust? To take this a bit further, another question is, do the same principles about trust apply when we are trying to persuade people to get vaccinated? This is part of what we're working on now at GPI in a follow-up project on vaccines hesitancy, where we're trying to see whether, again, trust in experts can increase trust in vaccines. And thirdly, to bring it even closer to the OECD forum of these days, which is running this couple of days, is how can we relate trust and integrity? So what does it mean to increase trust for integrity in public institutions, of public institutions and to public institutions? And if I can have the next slide, please. So what we did in our project was, first of all, to create a database. You can see the link to this database at the end of this slide. The idea was to actually manage to have as representative countries as possible on how governments around the globe employed expertise and evidence-informed policies to combat COVID-19. So we tried to select as much information as possible about the choices that the different governments made on how experts can be integrated in this particular instance to help them design strategies, but also communicate strategies for combating the pandemic. So our question was how scientific evidence fed in the policy process and informed policy decisions. The purpose of doing that was to contribute to the dialogue between academia and policymakers, so to try to see how the COVID-19 can be also a case that we can further use in order to enhance the role of experts in policymaking. The database that it has the form of a map. I'm not going to go to show it to you now because we don't have very much time, but it's a map where you can actually click and see what different countries did. And compare the different best practices and what has worked and what has not. If we can move to the next slide, please. Thank you. So what we did was that we selected 24 countries from across the globe that we selected because we thought that they were typical cases of distinct broader categories. So we wanted, although we couldn't cover all the countries, we wanted to have countries that can present what was happening in most of the world, so that we can generalize what we see in the map and also be able to compare. So we chose countries that were experiencing different economic conditions, different governance regimes, more democratic countries, less democratic countries, and different levels of public trust before the pandemic. So before we checked what were the levels of public trust before the pandemic in order to select these 24 countries. And then we also chose cases where we saw the very different choices of how experts could be used, and very different performance in the way COVID was actually how the governments actually managed with COVID, at least in the first waves. So we compared the numbers of deaths, the numbers of hard data, before choosing the countries, to choose countries that performed well, but also countries that didn't perform well, in order to see if we can also learn from possible mistakes. So the data collection was both primary and secondary sources. So we used the official documents issued by governments, international organizations, reports, media, academic sources, in order to fill in the information. But then we also went a little bit more in depth in 4 countries, and we did a survey on public trust to assess what were the public's perceptions on the government employing evidence-informed policies, the levels of trust towards the government and experts, and how they changed during that period, and also the changing levels of compliance with the measures. And also with when we were running that, we could also see the first reactions to the vaccines. That was just when the vaccines were out. So that was March last year. So to go to some of the findings, about experts and trust. What we found in all the cases was that there was a strong demand for evidence-informed policies during the pandemic. So the public trusted experts and the idea of evidence-informed policies more than before. Probably exactly because this virus was seen as threatening to everybody and as such an unknown enemy. What we also found out was that the reason why the public thought that evidence-informed policies is a good idea was what we call the technocratic, or what the literature calls the technocratic legitimacy thesis, which means that they trusted actually the expertise and the fact that the experts could actually understand the problem better than the politicians, than the bureaucrats, than the media. This is interesting because in other cases, in other crises, we see that this is not so strong, this belief that experts can actually provide the right idea, especially in crises like economic crisis, immigration crisis, that they are more political. Trust to experts is much less than in the case of COVID-19, because being a medical emergency, it was seen as something that experts can really talk to us about. It's also interesting to see that the public is saying that they would like to see experts' involvement in policy making continuing after the pandemic. What we found from our survey was that this is the case both for medical, but also for social sciences expertise. So there seems to be an increase also in social sciences expertise during the pandemic, which we wouldn't expect maybe, but it did occur, probably because the interpretation was obvious that could not be only by the medical experts, as there were other issues that had to do with compliance, such as economic issues, fatigue of the lockdowns, and their social scientists had a lot to offer. But what we also found was that the experts' involvement in crisis management has serious reputational risks for them. So in some of the cases, especially we found that in the UK and in Greece, we saw a drop in the trust towards experts during the management of the pandemic, since the public was blaming the experts for even public management or governance failures, since they were so visible in the communication of the measures and of the confinement. Also, it is shown that the experts play a very important symbolic significance in the communication strategy of the governments, since the public put a lot of emphasis on the communication. So when we were asking the different populations that we ran the survey, whether they thought we needed more expertise, there was a lot of the times the answer was that we needed more communication coming from the experts rather than the government, which is a bit problematic if you think that just my previous point was that by bringing experts doing the communication, we also had reputational risks, and sometimes the trust towards them was dropping. So it's important to find this fine line. And maybe we can go to the next one, please. Thank you. So some takeaways from the database and the survey combined. Just some bullet points that we've put together when we were trying to summarize everything we produced and written. So how can we make a better use of expert input for crisis resolution in general? It seems that expert advice and guidance should be balanced with political considerations. So it has to be clear from the beginning that experts can only advise, and that there are always political considerations that are taken into account, and thus no policy is 100% what the experts actually said. And I think it's important for governments to also make clear, and this is also important for integrity, to show that they remain in charge and to explain where and how they take into account expert advice. This will also limit the reputational cost for experts, and it will keep them involved in this evidence-informed policymaking. Because it's important to remember that policy experts many times participate voluntarily or for not very much money, or just because they think it's this is what they do, this is their work, and they want to promote it further. So it's important to keep them involved. So now, choosing between types of expertise in particular for the COVID case, it was obvious that it was very important, and the most successful bodies, expert bodies, provide information to the governments were the multidisciplinary bodies, because they managed to offer a more complete and resilient response to the pandemic. So we had sometimes very strong medical bodies providing expertise to governments that were very successful at the beginning of the pandemic, the first months, but then they lost a little bit of their dynamism, since they were missing expertise such as social psychologists that could talk more about confinement and how much it lasts, economists that could bring in ideas about the economy can also survive, sociologists, etc. And we would take this point further and say that this is also these multidisciplinary bodies. It's also would also work better in crises that are multifaceted, as most of the crises that we are facing in our world today. Yeah. The third point is about how to use expert input to increase public trust and compliance. And here we can say that what we found was that experts can act as credible policy messengers and complement the political messaging. So they're very important in the communication process, and we saw that in many countries that when you had somebody, an expert next to the minister, next to the government official that was in charge, there was really increasing trust. But this has to be a consistent practice, and there has to be justification given to the public on why we need the expert at this particular press conference, or why not. Yeah. The fourth one is about intragovernmental communication and coordination. And what we found in many countries was that there was a lot of the times these lines of communication and coordination between experts and different levels of government, especially in countries with strong regional government, in the UK, for example, in Germany. This was not always very easy to happen. So there is this intragovernmental communication and coordination is a point that needs to be strengthened. And also there is a need for coordination between experts on the central and the local level. So most of the times what we saw was that the experts were based at the central level, in the center of the government. So we were lacking information of what was happening in more remote areas at the regional level. And this needs to be strengthened in future crises in order to develop further trust in all parts of the countries. And if we can go to the next, please. Thank you. And this is my last slide to also open it a bit more to the discussion about integrity. And these are some thoughts further beyond the project. In reality, public integrity and trust go hand in hand and depend on each other. So it's only when institutions are persuasive to the people and they seem to work following the rules of public integrity that the trust can actually grow and develop. Experts can assist when the role is clear, and evidence-informed policymaking is taking place in a transparent way. So there has to be a communication also, not only of the fact that the policies are evidence-informed, but also on what types of expertise we are using, where exactly we need them, where their expertise stops and the government decisions start. And a final point is that experts cannot replace other forms of co-creation, that they are the way public governance is being managed more and more, and of democratic governance. So in a way, they have to be seen as a part of a broader community of stakeholders. Depending on the case, of course, they may have increased significance, as it was in the case of COVID-19, that if it was not for medical experts, we really wouldn't know how to go along with the crisis. But in other crises, other stakeholders may also be equally important. So there has to be a combination of different type of actors if we want trust and integrity to actually flourish. And these are my introductory remarks. Yeah, I would like to finish here and thank you for your attention. Thanks.
Thank you, Stella, for those insightful remarks and for being so very clear. So I'll pass over now to my colleague, Valsamas Mitselegas, who is Professor of European Criminal Law and Global Security and Deputy Dean for Global Engagement at Queen Mary University of London. Valsamas, I'll invite you to give your remarks. Thank you.
Thank you very much, Chair, and it's a great pleasure for me to be here. It's a great pleasure to co-organize this event with the OECD and our own Global Policy Institute, and to develop further our thinking on expertise and, of course, on policy making and policy solutions. And as you have heard from the chair, I'm a legal scholar, and I will remark, in a sense, on Stella's very detailed and groundbreaking research from the perspective of trust and integrity and, if you like, compliance, and the role of the law in ensuring compliance and the development of policy advice. And I would like to offer an analysis from 4 different dimensions on the relationship between trust and policy making and the broader theme of integrity that is the theme of this year's forum. So before I go to give you some thoughts on experts and on expertise, which is the theme of today's panel, I think we need to look at expertise from the broader perspective of the relationship of trust between the citizens and the state. And I think that this dimension has really been very prominent in the context of responses to COVID-19. And this relationship has 2 sides. So, the first side is trust from the government towards the citizen. And I think there we have had very, very interesting questions that lie at the heart of liberal democracies on how far the state goes in order to enforce its policies towards citizens, and how far citizens can be trusted in order to comply with the policy guidelines that are developed by the government and by experts. And you saw a variety in the context of COVID-19, you saw a variety of responses. You saw countries where the COVID rules have been introduced in a highly coercive manner with legally binding legislation and quite far-reaching, backed up by administrative measures, and others where the legislative response has not been as dense, and we have had a very big debate which is ongoing on the role of coercion and of legally binding rules, and even the role of criminal law in ensuring compliance with policy. And there are interesting questions about how expertise, if you like, is used or abused in order to justify these state choices. So, this is a very big question, I think, that in an extra dimension that perhaps Stella could respond on the role, if you like, of the law as a means of compliance, or if you like, as a means of coercion, and its positioning in the relationship between the citizen and the state. The flip side of that, which I think is also very important, and I think that brings the role of experts further to the fore, is the trust from the citizens to the state or to the government. And I think this is really a very big issue that has been really put into the fore in the COVID-19 context, but it is ongoing, and it is really a key question when we talk about broader issues of public integrity. So, is there trust or mistrust from the citizens to the government? And there, I think the rule of law plays a key part, and perceptions of citizens that the rule of law is followed by those who rule. I'm not going to make any further comment about the political debate on this currently in the United Kingdom, but I think that in that context, it's important really to remember that trust, the debate on trust has two sides. So it cuts both ways in a sense. So, and I think it's important really to remember this when we discuss the role of experts in this puzzle. The second dimension is specifically on experts, and I think there I will not add too much on what Stella has already explained, but I think that there are two issues that are key. One is the extent to which experts can be, again, co-opted, if you like, or used, to use a more cynical term, by the government in order to promote a certain agenda. And there, we talked about the reputation of experts, if you like, but also to some extent the credibility of experts. But another question which is broader, and I think it applies in a broader context when we talk about expertise, and I would welcome comments, especially from Stella later during the discussion, is the extent to which expertise and the use of expertise or expert claims are depoliticizing very key debates about fundamental choices for society, because sometimes we frame issues as technical, if you like, so issues that are in need of technical solutions, and we really, in doing so, take away the need for political debate on what is the right solution. I will give you an example which is close, I think, to the work of the OECD on a totally different topic, but you know that in the topic of anti-money laundering regulation, a lot of global standards have been developed by the Financial Action Task Force, which is an ad hoc body based within the OECD and manned by experts. So, so there's a very big debate about the democratic deficit of this process to develop global standards. And I think this applies across the board. So is the role of expertise really a threat to democratic deliberation? I think Stella mentioned this in her conclusions about, how are the experts positioned, in this framework. But I think there is a real question about the position of experts and how expertise is used in the democratic process, and what is the impact of that on democratic deliberation, if you like, because this can end up the overuse of expertise and via governmental claims to give solutions may actually lead to a high reputational risk for expertise itself. And I think that is quite a dangerous outcome, if you like. So this is the second dimension, I think, on the role of expertise. The third dimension is the dimension that is a rather more contextual dimension, and it is really, what do we think about the role of the private in all of this? So we talked about citizen and state, we talked about state and experts. How about the state and the private sector, and the role of experts within that? I think on COVID-19, we have had, again, a very interesting debate about the role of private companies, pharmaceuticals, and public-private partnerships, if you like, in order to provide solutions. And you have cooperation also of experts with the private sector, but also, again, the demonization of the private sector by states when things did not go according to plan. And I remind you of the very aggressive stance of certain European governments against certain pharmaceutical companies when the batches of vaccines were not forthcoming. And I think there the expertise, again, is interestingly positioned because you can see the private sector as a bearer of expertise, but also you can see the private sector as collaborating, if you like, with more public experts, including academic colleagues and so on. And these, again, can be generalized, in my view, in broader questions of governance and public integrity. So, what is the role of the private sector, if you like, in providing solutions or obstacles to policy debates? My fourth and final point, and I'm looking forward to the discussion, is the transnational element of trust and expertise. So we frame inevitably questions as national questions. Stella has produced a wonderful comparative study of countries, and of course each country has its own government. And Stella already mentioned the regional dimension of that and the diversity in national responses. But of course, there is a global dimension to that and a transnational dimension. And there, I think we have a very important question to ask also today within the forum of the OECD. To what extent can you have global expertise? And to what extent can you have, can the questions that we have already been discussing today, which arise at the state level, to what extent are these the same questions when we look at transnational or at the global level? And in particular, questions on accountability, if you like, rule of law and democratic deliberation. The key question, I think, when we look at the role of expertise there is, does the global mitigate the risks or does the global exacerbate the risks? And, can we have really solid responses if we have a more joined up approach across borders? So these are some thoughts on this very interesting topic. I congratulate my colleague again for this wonderful study and ongoing research. And I will stop here, but I very much look forward to the discussion. Thank you.
Well, Samas, thank you so much for such insightful points and also for delineating them so clearly for the audience. Thanks so much. I'm pleased to welcome now Professor Milasana. Kaleka Milasana is from the National Health Laboratory Service in South Africa, where she leads the laboratory management and academic affairs and research and quality assurance. And Kaleka, I must congratulate you and your colleagues in South Africa for being amongst the first to sequence recent variants and identify them and share that with the world. So you have the floor now.
Okay, good afternoon, colleagues, and thank you very much, Semak, for that. And I really would just like to thank the organizers for inviting me to share, some of my thoughts, as a South African. And I think, when we're talking about, the role of experts, in promoting trust and integrity, just very briefly, at the moment, I am one of the co-chairs of the Ministerial Advisory Committee on COVID-19, a structure that was set up by our Minister of Health, since the beginning of the pandemic, really. And, and I've been now in this position for the past 12 months. So it really has been very interesting to just see the interaction as scientists and the interaction that we have had with government and politicians. And so, I'm just looking forward to sharing a few, and some of
Kaleka, you've muted yourself, or someone has muted you because we can't hear you anymore.
Yes, sorry. I think I muted myself.
Don't worry.
Sorry about that. Yeah. Okay. So really, where I thought I would just start is, when one looks at us as a country, South Africa, relatively new democracy, but I was actually surprised to see, where is the trust of the population of the country insofar as government is concerned. And, one just gauging at community level, we know that there's a lot of frustration within the country, within, the communities, wherein, through all these years of democracy, there's a sense that we really are not where we should be taken. And in fact, it therefore wasn't a bit surprising, though it really is sad, when one looked at the barometer, by the Edelman Trust of 2020, that actually we happen to be the least trusted, that our government is the least trusted, when, comparing it to the 26 countries that were studied. So that on its own brings in an already existing dimension that there's definitely a lack of trust by public to the government. But also, despite this, I do want to highlight that actually when then the pandemic came in, it was quite interesting to see that a survey that was conducted around April 2020, because the Edelman Trust was done in 2019, a year before the pandemic. But, some of the studies, assessments that were done in April 2020, but, a survey conducted by Ipsos, the majority of respondents, actually, that 83%, indicated that they were satisfied with the government's response to the pandemic, which therefore means there's something that the department, that the politicians did in responding to the pandemic that sort of built trust within the communities. Though this was short-lived, but by the, end of December 2020, that had dropped to about 56%. So we really had the pandemic in that background. But I thought what I will just highlight briefly is when I look at where we are right now, there are a few things that I would think as a country we have actually managed to do well. And I want to mention just 4 of those. In that, firstly, how South African government responded quickly, in that we're amongst one of the first, countries that, quickly went into lockdowns and restrictions as soon as we had the first few cases of COVID-19. Now, what that allowed is that it therefore allowed enough time within health to prepare for the pandemic, because we were not prepared at all. Not as if that actually allowed us great preparation, but at least it gave us time to look at what are some of the issues that are going to come up. As a result, we were able to build capacity to at least cope with the inevitable upward surge of infections. So that quick response contributed to the improved level of trust. And secondly, a very, what actually appeared much earlier on, which brought into the establishment of the Ministerial Advisory MEC, we call it MEC on COVID, was the policies and strategies of our responses, of the government's response to the pandemic, was actually informed by science. Because much earlier on, it became very clear that at the establishment of the MEC, then the Minister of Health, whenever he was making any announcements, he would actually have us as scientists alongside of him, and every decision that was made, it really was very clear. It was clearly made that it was actually based on science. There was a lot of talks that scientists gave alongside the politicians, even when the president was actually having this, the meetings that we had, and I'll talk to that transparency as the next third point. They actually were surrounded by science, and that gave a lot of credibility and built trust by the communities. The third area was transparency. Like I say, there were talks everywhere, and even actually the Ministry of Health, he was always on national television, and we actually as a country had what we now call family meetings, where the president of the country will call a meeting and says, this is where we are now, this is the plan that we have, these are the decisions that we're making. And also even the data on number of cases became available on a daily basis. So there was a lot of transparency earlier on, in the response to the pandemic. And I really think this built that trust. The third area was actually when we saw this sectoral collaboration, where the private sector as well as the public sector, the academic institutions, everybody came together to say, here's a problem that we're facing, and how can we really respond in a multi-sectorial collaboration and collaborative response. So really those for me are the two things that built the trust. But now, we are now 2 years into the pandemic, and how have we fared insofar as this is concerned? As we now have gone beyond the area where we're looking at how do we contain the pandemic, and we're moving into mitigation, you now begin, there's a sense where there are a few things that are creeping up that are actually eroding that trust. And what we're seeing is, yes, the early restrictions were critical and important and served the purpose. But what has been happening is that now there's been an overly cautious approach into lifting those restrictions. And as a result, the different structures in society are feeling, really, should we be taking this long? Could we not have really made better decisions to get the economy back? And that's where you now begin to see, whatever that people had looked up to before, there's been a lot of grumbling of, how are we then going to lift these restrictions? Or maybe the government is taking a lot longer to lift some of what should have been lifted a long time ago. And second to this, cautious approach has been how some of the restrictions actually tend to be uninformed and completely non-scientific restrictions. And people now are going back to that and are realizing, there were a lot of things, whilst yes, science was driving, we saw that because then as the MEC advisory body, the important point is we're advisory to government. But at the end of the day, the final decision comes from them. And you would find that sometimes you submit, advisories, and by the time they get announced to the public, there are a few additions that would have come from the various, sources and offices of government. For instance, some of the bans, there was a ban on the sale of cigarettes, and everybody's asking, what has cigarettes got to do with the pandemic anyway? Banning of some sales on clothing. What has that got to do with anything? So this is now, it becomes important, the consistency of, and also the reliance on science starts slipping through, and as a result, what is actually happening here? And I think one of the biggest blows for us as a country has then been the fraud that has been around all the procurement processes for, COVID-related responses, whether it was for PPE, and it didn't help that, unfortunately, our Minister of Health actually ended up in a scandal. So you find that now this, the communities are feeling, well, we have been doing well, but obviously it is clear that some of the politicians are not really out there for the people, but for enriching themselves. And this has dealt us a serious blow in that we then tend to lose that trust that should have been there, where if only everything else had gone well. And I think just the general political stability in the country, where people are feeling frustrated, we haven't achieved what we had hoped we would have achieved. And the pandemic has been with us now for 24 months, and it's obviously not going to go with us. Let's go back to some of the fundamental issues that we have in the country that don't seem to be, to be addressed. So for me, it just points to saying, when we're talking about public trust, it really is very fragile, and once it is broken, it becomes very hard to regain once it is lost, and it actually can set us back a few achievements behind. And also it tends to permeate to other areas of government that might be doing well, because now there's a general sense that maybe people are not about the people, the politicians are not about the people, but about enriching themselves. And this really becomes a critical issue, which as a result then we have seen in the pandemic, it then points into us having this whole issue of vaccine hesitancy. Has government got a hidden agenda, seeing that they are not completely for us? And it really just caused a response to the pandemic to be even harder because of this lack of trust. So really, I think for me, what I would just highlight then, and I'm almost done, is to look at what then have we learned about the trust in experts. I think insofar as experts are concerned, the early adoption of the scientific advice by government and the perceived success thereof, it really led to an increased public confidence, in scientists. It was very clear because scientists were put in the forefront. We were able to say, this is how much we know, this is what we don't know. As new information comes, we'll be able to come back to you. And really that made a big difference. And the second part was the transparency of scientists in the country, which I think the whole world has seen, how when we're faced with a beta variant, we actually were upfront and said, we've got a variant, we don't understand where it's coming from and how it's going to behave. And the same thing we saw with Omicron as well. Even though there was a massive negative, backlash, but really I think subsequently then it became clear that because of our transparency, we actually managed to raise the bar of what science is all about, and how if we really are up there and up front and we're monitoring situations, we can quickly turn situations around. So I think transparency was really what came through within the South African scientists. And I think also now just generally the availability of information, if we look at, there's like a massive availability, somebody submits, any findings in a journal, there are preprints that are available and that becomes accessible to everybody. And I think for me, these are some of the things that strengthen the trust on scientists. And these are things that we really need to make sure that we keep on moving forward and ensure that, these are maintained into the future. So really, I think for me, let me just actually just end there to say it's very, very important. And sometimes it becomes very difficult as scientists to strike that balance, because how do you then respond when you see that some of your scientific advice is not accepted by the politicians because of whatever issues that they may be struggling with? But from the country, we have made it very clear that when we submit an advisory to government, even if government does not take that, but what we really want to demand, that advisory must be available to the public so that the public can see what we have said, irrespective of what government ultimately goes for. And I think it becomes important for us, for our own integrity, and also for sustained, respect as scientists in the country. Let me just end there. Thanks, Sir.
Kaleka, that was beautifully laid out. Thank you so much for joining us today. We're going to open this to Q&A in a moment, but just before we do, as some of you on the call need to do a bit more work in putting things into the Q&A, I'll give you a moment or two to collect your thoughts. We've got 3 experts here to answer your questions. Please do put some in the Q&A. But I just add a few points that Kaleka and others have made today, triggered some thoughts from me. I'm a medical doctor, and during the pandemic, I coordinated the research of 5 hospitals in East London that serve 2.5 million people, including one new hospital that we built inside a conference centre, which we called Nightingale Hospitals. These were temporary hospitals, and this was just filled with ventilators. We would have been able to ventilate 500 people in there. In the end, we only ventilated 55, but we managed, with trust and integrity from the patients and public, to enroll over 12,000 people in research. But I'm going to give you one example of where trust and integrity had to be actively built, because in my part of London, a very high proportion of the population are from diverse communities. We've 97 nations, 60 languages, and we're the 3rd most deprived area in the United Kingdom. So we have many of the problems that people encounter in other countries. And this population does tend to have shortened, healthy lifespan. For example, in the immediate borough around my hospital, the average healthy life expectancy of a woman is 58. She lives to 82, but she lives for 24 years with illness. So against that background, Kaleka raised and others raised this issue of trust. And so we were approached in September 2020 to establish a vaccine trial program to understand what vaccines should be brought live. And of course, the world had developed these vaccines in breakneck speed, breaking all possible boundaries of ever done before, and bringing them live for patient availability. And to some extent, what colleagues have said here about our potential emergence from the period of restriction now, it is in no small part mostly due to the vaccines. And so our vaccine experience was this. So we have really strong patient and public engagement, because by involving and engaging your patients and public in your research, they give you a perspective that the clinician or the scientist doesn't always have. In fact, they're often in a setting of major illness, they're often much less risk averse than clinicians are. So they would actually, their appetite for risk is different because they're affected by illness. But in East London, when we went to establish the vaccine trial program, we quickly tested on social media and got a resounding, we're not going to come to the hospital to be vaccinated because we're scared of the hospital. It's full of people with COVID. Now, actually, as it turns out, they weren't wrong because our clinical research centre was on the 13th floor, and the 14th and 15th floor were our ITUs with over 100 beds filled with people severely ill with COVID. So we had to look for a mechanism to restore that trust. And this may surprise you, we discussed with our local council, and we rented a library in a place called Bethnal Green, which is a lovely old building. We just moved the books to one side, and within 5 weeks, we built a clinical research centre in the library. Now, because that library was a centre point for the community, we enrolled over 800 people in the Janssen vaccine trial. Now, the Janssen vaccine has never been used in the United Kingdom, but actually we really want to do the trial because there are many countries, and I think, Kaleka, unless you correct me if I'm wrong, South Africa is one, where the Janssen vaccine may have been used. I don't know, but you'll correct me in a minute if it was or wasn't. But the Janssen vaccine was trialed by us, and over 800 people took part. And 27% of those were from minority communities. So that's not the usual experience. And it's because we listened to the community, heard what they were saying, considered their concerns, and then acted on it. So we were able to say, you said, we did. And that was the secret to success. So I echo the many other panelists' comments here. And now I'll stop talking and cover your questions in the chat. So, and I'll raise a few other things. So first of all, thank you, Beatrice, for celebrating Stella's work. So Stella, you're getting credits for that presentation earlier. Well done. So Kirsty Gardner's asked the panel, and I'll let you put your hands up if you want to take this. It'll be interesting to see how integrity interacts with trust. And thinking particularly about the United Kingdom, government integrity is viewed as extremely low, particularly at the moment with Partygate. That may not be familiar to everybody in the world, but it appears there were at least 20 celebratory events held in the number 10 Downing Street, our Prime Minister's house, during the lockdowns. And this has caused some considerable distress and has some risk to the Prime Minister and his future as that person. And so the vaccination rate, however, even given that, is pretty good. Why might we be at odds with what one would expect? Is individualism, collectivism, and orientations towards social responsibility impacting this integrity trust relationship? Who'd like to pick that up? Kaleka, do you want to have a bit of a go at that?
Okay, I can give it a try. I think, for me, from where I sit, trust actually develops through a continuous, a demonstration of integrity. So as people see that there's continuous integrity, then that's how trust is built. And so the minute there is a gap in that integrity, it erodes into the trust. And so it becomes very important to ensure that, you can't say, well, I've done well today, therefore the community must trust me. But communities want to see consistency, and they want to see that you are also actually consistent in your message, in that you are all about serving, the general population rather than looking at yourself. So I think for me, really, that's where the interaction between trust and integrity, because sometimes people might think, it just takes one error for the community to stop, to have mistrust. It is true. The minute anybody does anything wrong, we all focus on the negatives and we completely forget about the positives. So it's a high call to those that are in leadership for consistency. And then, like we always say, you earn trust, and it's actually even harder to maintain that. Yeah. And that's why sometimes it might be very difficult. But, well, that's what it is, and that's what people want to see. If you are put up there, you are expected to always perform and never allowed any mistakes. Tough as that is, but really, I think it's only really going to take us that consistency for us to maintain the trust that we're looking for from communities. Let me just end there. Maybe somebody else wants to add to that.
Thank you, Kaleka. Stella, do you want to add there? You made a presentation of some research. Have you got some additional insights to add on the background of Kaleka's excellent answer?
Thank you very much. And yeah, maybe it's an opportunity also to introduce Kirsty that made the question, who is a social psychologist in Queen Mary, and I'm very happy to work with her now in the project on vaccines hesitancy. So we will continue discussing Kirsty's question, but I think certainly what Kirsty observes is true for the UK, the community spirit and the vaccines uptake has been great, independently of the government's faults, and this is probably because of the history of the country in this type of and the culture of the country in this type of events. So I mean, it's something to look into in more details. But I think Professor Kaleka Milsana is right to say that it's a very difficult. We have to be very careful about this linkage between integrity and trust, because even if we have the culture and the history and things work out well, if there is a continuous issue of breaking the rules, or of the issue that you were mentioning before about the procurement, so corruption coming in, then there is very little the experts can do. We cannot expect from the experts to do what public officials have to do. So it's a shared responsibility for each of these actors to play their role correctly, as you have been bringing out in your presentation. So thank you. I don't want to take more time so that we can see more questions.
Thank you, Stella. So, Balsamas, this is one for you from Marika. So, Marika says trust and integrity are strongly linked. The role of experts in decision-making is very important, but they can also help the government gain citizens' trust. Trust in public governments must be built day by day with integrity, legality, ethics, and anti-corruption. Do you have any views on that, or how we should go about that, particularly about the gain of citizens' trust by experts supporting government?
Thank you. I couldn't agree more with this remark. And this remark, I think, hints also at a holistic approach. The fact that, we cannot expect trust in a piecemeal way. We need to have an environment where, there is respect for the rule of law. We have a very big debate in the UK currently about what rules apply to which constituencies, whether there is equality before the law, whether there is credibility in the advice. So, that's why the first thing that I mentioned in my presentation is not so much the role of experts and government, but the relationship between the citizen and the state. So, and I think, as was mentioned, this is an ongoing relationship, and the foundations are tested on a daily basis. You cannot expect citizens to trust the government on vaccines, for example, or on a public integrity message if they don't trust the government more broadly. And so, I think the remark is very, very, very good in terms of looking at the interrelationship of many different factors. I would like also just to make a comment or a question, perhaps to our chair, because I would be really interested to your answer to the previous question about why the British public got vaccinated, although, trust in the government is not as high. And I'm not sure whether this demonstrates perhaps also a trust in science and by the public, which is independent from the trust in government, and maybe a trust in British science, knowing how important Oxford University has been in the development of global vaccination efforts.
Yeah, so Balsamas, I can have a go at that. And so as you remember at the outset of the pandemic, because everyone was so surprised, we went to lockdown, people began to die in numbers, and first in Italy, but then in other countries, including in the UK, people went out of their houses on a Thursday evening to applaud the health service workers. So I think, although there is a distrust in vaccination to some extent, and even in my hospital where we've 16,900 staff, there is still a small number of staff, just a few hundred, who've never had a dose of the vaccine, but they have made that choice. I think that the innovations, the pace of innovations, the integrity of some of the experts who appeared alongside either government, I think, to the point of this question, actually did enhance people's trust in that they should have a vaccine. And then I think we shouldn't underestimate peer effect. So if my friends or my family are saying, have you been vaccinated yet? Then you start to feel you should consider this seriously. So I think this is a mixture of experts at the outset saying this is a good thing, and then the community amongst themselves building trust. But I'd be interested to hear from Kaleka what she thinks happened in South Africa in that respect.
Yeah, actually, I think in our country, there were just so many odds against the whole vaccination program, really, when you look at it. Because when, like I was saying earlier, when things had started well, then there was a lot of pressure for government to secure vaccines. And we went for the AstraZeneca, and it just so happened that this was around the time when the beta variant was identified. And when we looked at science and how the beta variant behaved with the AstraZeneca specifically, the results were not looking good. So there was that blow. And now when everybody had wanted a vaccine, it had to be withdrawn. Yes, there are people who have got, different views whether it should have been withdrawn or not, but I don't want to get to that today. But then that was a big blow. Fortunately, we were able to bring in, the Johnson & Johnson, the Janssen product, through an extended, a study, criteria, which then was available to the healthcare workers. But I think, so there was that one blow. And then when the Johnson & Johnson was in progress and, increasing well, the vaccination numbers were increasing, then there was the hold because of the thromboembolic phenomena. So this as well then, caused a lot of issues around the public that, you told us these things work, and what is happening now, we're seeing this, there's a side effects, what's up here. And unfortunately, as a country, I think maybe as scientists, as experts, we could have managed the misinformation and disinformation better, because there was just such flooding of, in social media, of misinformation and disinformation, which I don't think we handled well. I don't know anyway what's the best way of handling that, such. So really there were all these such that even though there may have been trust on science, by the time, the vaccines became available, there had already been an erosion. As a result, we really are not where we would have wanted to be as a country in so much as vaccination rollout is concerned. And now to try and beef that up has just become even more difficult. So you find that, any little thing that happens, even though you may think you've been doing well, it can actually just set you backwards, a few, miles behind. Yeah.
So thank you, Kaleka. So Stella, I'm going to move us to Guillem's question here. And he says, in France, in the middle of an electoral campaign, we were hit with the issue of consulting cabinets receiving huge payments that didn't pay tax. Electors suddenly realized that the private sector is already controlling major areas of the public sector, such as informatics, and they organized the anti-COVID vaccination in place of public servants. There could be other pandemics and other extreme situations. What about the idea of codes of ethics to strengthen fiduciary trust and the taxonomy of dignity violations? So, Stella, we start with you, then go to Valsamus and see if Kaleka's got something at the end.
Thank you. I mean, I don't know the specifics of the case in France that I put here, but certainly the idea of codes of ethics are there as a way to strengthen trust, although to go back also to Valsami's point, these are voluntary, normally, codes of ethics, and the question is how much we need voluntary schemes or how much we need compliance, both for the public and the public servants themselves. We need both, of course, but I'm just mentioning that as a weakness of this codes of ethics. But yeah, I mean, I think we are repeating. It's coming to feed into the topic of integrity and public trust. It's another case where we see integrity breaking up and what it means for public trust.
Yeah, I think those are very good points. Balsamas, any thoughts?
Yes, no, just a couple of comments on that. I think that that is within the broader debate on the role of the private sector in delivering public services. And there is an ongoing conversation on that also in the United Kingdom. And I think in this context, the issue of transparency is very important, and the issue of accountability is very important. And I think that's directly linked to also to anti-corruption and public integrity. There are issues, for example, of public procurement. I think in the UK there has been a very big debate about abuse of public funds going to the private sector and so on and so forth. And these are very big questions that can really erode trust, and they can have a spillover effect in eroding trust in public health responses. And I think we have seen this in this country at least.
Yeah, I think you're right, Balsamas. So, Koleka, have you seen this happening in South Africa?
I must say, probably for our country, even though I'm sure there must be, corruption that happens in the private sector, but I think, fortunately, because that's public funds, a lot has been focused on government. And unfortunately, there's been a lot of, corruption within government. As a result, the focus has really been on government and how, can we get government accountable and ensure that, the corruption is actually stopped one way or another. And unfortunately, we have not managed to do that as a country.
No, very good point. So Sarah's asking us, what can be the lessons for sustainability? Human health and environmental integrity are intertwined. We need a transition to a sustainable society and economy, which is necessary to protect human health. To build back better, society and governments must reflect on what to do differently and what to stop doing altogether. Do you want to start, Stella, and we'll see where we get with this one? Quite a challenging one.
Thank you. I think this is a great question, and it's also very important in broadening our discussion because we wanted to really use the COVID-19 as an example for lessons drawing. And at the beginning or somewhere in the middle of the pandemic, when we were all locked down, we thought that this was an opportunity for a greener world because we were moving less, we were polluting less for a period, but this didn't last. And what we see now with the war in Ukraine is that again we kind of forget the climate crisis because there is a more immediate threat, as it was also with COVID. We tend to respond to the immediate threats. But I think a lesson that can be learned, and turning back to the experts' question, is that we need to really move to this co-creative public governance, which is also transparent. So it's crucial. I mean, we know that experts were talking about the climate crisis and how sustainability is necessary for decades, and nobody was listening to them. To have them being able to be more influential, but also for the people to actually accept what we need to do, there has to be more involvement. As yourself, Mark, was pointing out about what you've done in the case of the vaccines and the trial. It's only through bringing together the stakeholders and designing together the future policies where we can make clear what is for the experts and what is for the community and what is for the private sector, and how they can all contribute in order to deal with this kind of crisis. And that's it.
That's very helpful. Koleka, what to do differently and what to stop doing altogether in South Africa? What do you think?
I think the first thing, if you're looking at what to do, is to really just make sure. I mean, I think as Stella has said, there are lots of lessons that we have learned during the pandemic, and we need to make sure that the good lessons are kept into the future. And for me, what we have seen has really just been the collaboration between the private and the public sector, and even the academic sector for that matter. And so we need to make sure then, how do we continue with that, working with that partnerships into, into building a sustainable society and economy. Now, I'm looking at this question, it's also talking about human health and environmental integrity. The other thing that actually we have seen in the country is, apart from doing, the surveillance of, human cases of COVID-19, we have included, wastewater surveillance. And we need to continue this, because then that's where we can come to the One Health approach of any, other infectious disease or any other approach to whatever might come to us into the future. So I would really think when we need to stop just looking at issues like with blinkers, just this is what we're having right now. But because we have seen this actually during the COVID, in that when we're focusing on COVID, we lost touch with the other health issues in the country. So there's got to be a way of how do we then actually make sure that we work on this all at the same time. So I really think for me, that's one thing that we would need to be careful about into the future.
That's right, Collector, I agree with that. And just in case anyone's not familiar with how we're using wastewater in this context, we're using the wastewater to identify bacteria and viruses at the earliest possible stage. And what Collector's suggesting is by surveying that, you and I might detect this before it's really serious and be able to act earlier. So it's an early warning system. It's the same system we're thinking of here. So Jana Nova, though, is giving us all a reality check. Jana Nova's from Brno and has brought us back to reality with, this is truly an academic debate, guys, but the reality is actually cruel. People are confused and the level of mistrust in governments and experts is extremely high. Can you share your opinion, Valsamas, on how we proceed in such a spoiled atmosphere? What are we going to do to gain trust in the future?
I got a tough question.
Sorry, I did that
and I wish I had the answer to you, but I think that it's interesting because we are discussing today about trust in the context of COVID-19, and there are voices that are actually saying, if you really want to view the glass as half full, that actually COVID-19 gave an opportunity for a greater trust in experts than we had before. So, before, we had this kind of total really collapse also within the public discourse, and sometimes in many countries in government discourse, attacks against experts that, within a very populist framework. And I think that with COVID-19, the experts got their own back a bit. And there were many, many examples of good practice, including, as we heard today from our chair. And I think the public can understand this. I think, we need to give the public some credit, and I don't think we can generalize. And I think COVID brought perhaps a reality check about the need for justified, transparent expertise and advice. And we have seen politically, at least this is my view, that COVID has made a lot of populist politicians falter. So I think that I do not have the golden solution for you. I think that the more we give space to each other to discuss the key issues, the more we try to substantiate and justify our views, and the more we approach some issues in good faith, I think the more beneficial it will be, really, not only for trust towards experts, but also for democracy as a whole.
And so, Valsamas, those are important points. One way of looking at the answer to this question is that actually we, the experts, should trust our public and patients to be more involved and engaged from the beginning. Because actually what it turns out is, in the pandemic, people understand uncertainty. Life is uncertain. It's a series of uncertain events and then you die. But actually, people can cope with uncertainty, and they can cope with the experts having a boundary of their knowledge providing you're open and you share it. I think that's the route forward. So I'm going to move us on to Natalia's question, which goes to you first, Kaleka, which is, you spoke, Kaleka, about how you managed to foster trust during COVID-19. Research mainly demonstrates trust has declined. I think you said some of this due to the government in South Africa's handling of COVID. Statistics indicate corruption is high. We've touched on this before. I just wanted to see what methodology is employed in South Africa and perhaps other African countries to measure the success otherwise of efforts towards fostering trust and integrity. So Kaleka, you're on point for this one.
This is actually a very difficult one, especially because, I mean, this is something that one faces every day, in that in the midst of what's happening in our country, how do we get the word, the voice across to government that actually you are not doing well? You know, and it really is very, very difficult. I actually don't have an answer, because you find that apart from the frustration that you see at community level, even within scientists, I mean, you know, that's why earlier on I was saying we as the MEC had to actually make it very clear to government to say our advice is based on science. So whatever else you've got to engage, or whoever, whatever party or body you've got to engage with, which then results in you deviating from our advice, fair enough, you've got the option not to take our advice, but at the same time, let it be known by the general public what we have said. Because, you know, unfortunately, you know, we cannot afford to have our integrity tarnished. So it really becomes very, very difficult. And I really, maybe, you know, some of my core, panelists can help us as a country. How do we really, because, I mean, right now, we've got a serious issue of corruption in the country. And our president has been saying we've got to fight corruption. I mean, it's been years now, but we're not seeing that coming through. And how really can, you know, how are we going to change this? I basically don't have an answer. Yeah. But it is a necessary step that needs to be taken.
So, Kaleka, let's see if anyone has anything to add. Personally, I hesitate to suggest anything for improving trust and integrity when my knowledge of Africa is limited to a few.
Limited, sure.
I don't think we should turn up from outside and suggest that. But Stella or Valsamas, have you any ideas here? No. I'm sorry, Kaleka, we're no use to you whatsoever. But František from the Czech Republic here has said, how can experts deal with misinformation? We sort of covered this. But Stella, just to go to you now on this, when some cases the misinformation is supported by other experts or self-declared experts, we did see a bit of this in the pandemic. Stella, what are your thoughts? Anything from your research that bears on this?
Thank you. This is a very, again, relevant and excellent question. We were wondering about that, and we had a question in our survey to see if people trust more formal experts more, or the self-declared experts. And maybe the positive message here is that not very many people actually trust these self-declared experts. This does not mean that misinformation is not a very important issue, but I think I would take it the other way around. It's not what the experts can do so much, but more about understanding the communities that actually tend to believe the self-declared experts, or to consume material that is actually misinformation. So it's more to understand this, and then trying to approach these communities and to explain the different types of information, and why maybe what they're getting from somebody that they trust because it's a part of the community, but maybe has no idea about the vaccine, for example, is not to be trusted. So I don't think the experts themselves can do very much apart from being clear about their methods and the limitations of their knowledge. But we need to understand why this misinformation is attractive to particular communities and types of people.
Yes. So it's a very important point you make. Valsamas, any insights here?
Just to add to that, I also wouldn't focus on the experts, but perhaps I could focus on the transmitters of messages. And so called expertise. There is a very big debate, which is not an easy one, on the role of the media and in particular on internet platforms and providers in spreading misinformation. And I think this, it's very hard to regulate. This raises serious freedom of expression issues. And so, you know, it's about, but there we need to see how the debate is being framed in a sense, and, you know, how much prominence misinformation is given in our public discourse.
Definitely, Valsamas, we saw during the pandemic a range of opinions being expressed, and probably they created a debate, and some of that debate may have been a bit unhelpful, but actually I think people are probably more suspicious if everyone's agreeing than if everyone is, there's a range of views. I think we like debate, we like to know what to do, but we want to form our views and we want to work out what to trust and what not to trust. And I think that's important. The other thing I saw, and I'll just go to this next question now, is I noticed, and Kaleka, I don't know if this happened in South Africa, I noticed some of my colleagues, won't say who, but I noticed them turning up very regularly in the media. And when I'd hear their voice in the morning on the public affairs program, the Today program, I said, you know nothing about this subject. I know exactly what you work on. What are you doing here talking about it? And I was saying to the team before we started, I used to get rung up. Every time there was a new variant, I'd be rung up by the Today program and say, can you come on and talk about this new viral variant? And I said, I don't know anything about viruses other than we've got a very bad one at the moment, but I do human genomics. I don't do viral genomics. So you need these people to do it. But I know that some of my colleagues did that. And I do think around the self-declared experts, that is when you enter the danger zone. Did you have self-declared experts, Kaleka, in South Africa?
I mean, I'm sure. I mean, there are self-declared experts everywhere. Actually, no, we had some of those in the country as well, and that's where it really just becomes very critical to see how do you then manage those and the messaging that they get across, you know, into the public. And for me, whenever we talk about misinformation, I always say what as experts we need to do is to focus on the correct information. And then let those self-declared, you know, over time, the communities, they're not really foolish. They will pick it up. If you insist on what is the correct information, you know, without even referring to the misinformation at times, unless you are specifically asked. Yeah.
I think you're absolutely right. Absolutely right. So, Stella, we've got one here. I'm going to combine Sebastian and Ma's questions. We've observed acceptance of government measures, particularly in the first wave. Governments then claimed an increase in trust, which they used to introduce a lot of legislation, impose rules, which were not really based on full democratic process. And I think Valsamas will also come to you on this one. To what extent can we talk about trust development, since trust is a long time process? So probably one sentence from each of you on this subject. And then finally, we'll talk about, do we need to review ethics?
Yes, thank you.
Stella, do you want to start?
Thank you, Mark. Yes, I think Sebastian is trying to, if I understand the question correctly, is about whether we can actually have a project about building trust, or if it is something that has to be just happen slowly. I mean, of course it will happen slowly, but I don't think measures such as transparency or pushing for more integrity, bringing out cases of corruption and trying to fight them do any harm. Yeah, we need to do all these things, although we know that it's a long time process. And about ethics in media, surely, but again with a caveat that it depends again on whether the journalists themselves want to follow these ethics. There are a lot of initiatives on that, but you know, maybe they're not as successful.
And societies had a few goes at that one and never quite managed it, I think I would suggest. But that's for the rest of you to judge. Valsamas and then Kaleka on these two.
Yes, I will focus specifically on the kind of rule of law aspect of this question by Sebastian. I think you're right, and we need to be vigilant about emergency responses. Sometimes I understand the need for speedy responses, especially you remember when COVID first emerged, and you know then we needed to have measures immediately. But we need to be reflective about what happened and perhaps what went wrong, because sometimes you have very draconian measures being pushed on an emergency framing, many of which are not necessary. And I think the danger is that the state of emergency becomes permanent. So I think it's an opportunity really to reflect back and to see what was right and what was wrong, and really to abolish what was wrong.
Yeah, absolutely. Kaleka, your thoughts?
Yeah, actually, right now in our country, we're going through a very interesting phase wherein we're moving from containment into mitigation. And we're moving from the state of disaster to saying, when is this going to be, scraped off? And then there's an issue of, yes, we understand this should be going away, but then what systems must be put in place? What regulations need to be put in place into the future so that we don't have to go back to the state of disaster? And really, there's a significant percentage of the public that feels all government is doing now, because of the draft regulations that have been sent out for comment, by the public. They feel what the government is now doing, they've just shifted all what was in the state of disaster into these health regulations, and they still want to control what gets done. And, we're still trying to see how best to come out of that. So really, I think it's an important point that we need to be very careful about, that, whilst there are pandemics that come in that might require certain strict measures, but it becomes important not to then end up, translating those into a draconian type of, of government, and to actually break that during the phase where COVID is still with us. It can become very difficult, because there's always going to be a reason to hide behind why you can't stop using certain restrictions, because, well, we're not sure, there might be a severe a variant that's going to come in, so we want to keep this in. So it becomes very difficult to play around that space.
Yeah, I completely agree with you. Kirsty's made a point in the chat, and then I'll close because we're at our time. We need to address inequalities in society, lift up marginalized and disenfranchised communities. I won't ask the panel because they're all going to agree with you, Kirsty. So you're absolutely spot on. So one other thing I would just say before closing is we, Kaleka will attest to this, have lived through a period of unprecedented innovation in medicine and science. This has not happened before. We've done things in months that take us usually 10 years. We must never, ever go back to the way it was before. We have to seize the moment of innovation and make sure we deal with the inequality that Kirsty highlights. Thank you all for attending this 2022 OECD Anti-Corruption and Integrity Forum, and for supporting the Global Policy Institute at Queen Mary University of London and our knowledge partner sessions. I'd also like to thank Kaleka, thanks so much, Valsamas and Stella, fabulous debate, guys. Thank you on behalf of everybody in attendance so much. And I would like to thank all the participants. We know how busy you are. Thank you for giving your time to join this discussion and stimulating this debate. Thank you all. We'll see you next time. Bye now.
Thank you very much. Bye.
Thank you, Kaleka.
Thank you. Bye.
Bye.